Hi, okay, I'm in my 6th week of post-op recovery from rotator cuff surgery. I really kind of thought 6 weeks was some magical number and I would see a lot of changes, but there's still a lot of things that need to happen. So what am I able to do? What am I not able to do? I am sleeping in my bed, but it's not comfortable for me. And again, everyone is different, but I was encouraged to try to sleep in the bed because I would sleep better. I don't necessarily feel I sleep better. I have to prop up a lot of pillows to make it comfortable, and even then I'm not always comfortable, but that's the way it is. And I cannot fix my hair yet. I can't get my hand anywhere up that close. Dressing is getting easier. While on vacation in hot weather, wearing short shirt, like long sleeves are easy because you can pull the sleeve down and lift that arm up. But when it's a short sleeve, you can't get that other hand up there. So I have to like grab the back and pull from behind to get it up over my head. So as long as it's not tight. If it's tight, forget it. I could not pull a shirt off. So that's getting easier. I started physical therapy right before I left for vacation, so it was really at 5.5 weeks so that they could put me on a program I could be doing while away. They gave me 6 exercises. They're passive exercises that I do twice a day. Right at 6 weeks while I was away, I was able to get out of the sling. I traveled with the sling both coming and going, which was a really good thing because people bang into you. They don't care. I think you need to put like flashing lights on that sling so people see it because they really don't. Was given the opportunity. I could have traveled at 2 weeks post-operatively and 4 weeks. There were things, and I chose not to, and I'm really glad I didn't travel because even at almost 6 weeks, it was very difficult. So when I got out of the sling, I walked for a half hour 2 days in a row and noticed that my arm was swelling up all the way down to my wrist. When I called to ask about it, they said that maybe it was just too much going from the sling to no sling at all. So they recommended that I go back in the sling an hour at a time, a few times a day, and then also to make sure that I was icing the shoulder, which I was not really good at because I was on vacation, and how convenient is that to ice your shoulder? So I even like sleeping, propping pillows up. Sometimes if I go in the sling and then with a pillow, that makes it easier. So I'm not totally throwing that sling or burning it yet because I think it's helpful. PT was not as bad as I anticipated. I read people talking about how awful it was, and again, everyone's different, but you realize how much weakness you have and limitation of your range that you have, but it wasn't excruciatingly painful at all. I would recommend that you don't take a pain pill or ibuprofen or Tylenol beforehand because that'll just mask your feeling and you may overdo it. This way you know your limits because you have nothing in you. I was told I could drive, but I have not driven yet. I think I will start that. It'll end up really being at 7 weeks that I will drive just because of being on vacation, other people were driving for me, so I didn't need to. I do think it's going to be difficult. I won't go long distances because I don't have a lot of range. I can't get my arm halfway up. It only goes like about a quarter of a way up. And I feel a real strain and heavy pressure up there. So, yeah, I have a long way to go. But, it's definitely better from where I was, and it's going to just continue to get better. So I will keep you posted at 8 weeks. I'll check back in and let you know how I'm doing.